We are back with Dr. Michael Cinoman, Cone Health Pediatric Intensive Care Unit Medical Director. And so we're talking about all things RSV related. Let's talk about RSV vaccines being given at the same time as like a flu shot or a COVID-19 vaccine. Can we do that? Should we space them out?
You can give them at the same time. There is a small increased risk if you get the vaccines and again, I want to remind everyone that the RSV vaccine is for adults. It is nirsevimab is the name of it. It's an immune globulin, so it's not a vaccine, but they all can be combined and given at the same time. There is a slight increased risk of developing fever or a sore arm if you get them at the same time. So some parents may want to weigh spreading some of these things out for themselves or their child versus the convenience of getting them all at the same time. But there's no medical reason they all can't be given at the same time.
You just might be a little cranky.
You might be, yes. Little arm might be a little sore.
Right, okay. Now, in addition to vaccination for those who are eligible, what measures can all of us, families, friends, and things take to reduce the risk of RSV?
Well, we've talked about the major one by far. The vaccines and the immune globulin you can give to children are phenomenally effective at preventing severe disease, whether we're talking about the COVID, the flu, and now RSV, which we've worked for a long time to have a good tool against. Other things like washing your hands or just general care, healthcare cleanliness are fine. They just don't tend to work very well. As I said, out of the 4 million babies who are born every year, two-thirds of them catch RSV anyway. Respiratory viruses are terribly contagious. If you wore a mask all the time around your children, around everyone else, you probably would prevent passing these things around. It's just not very practical.
For sure. All right, so if a parent or a caregiver is concerned that their child may have RSV, what should they do?
Again, most of the time, remember, RSV is just a cough or a cold. And as long as your child is otherwise eating well and feeding generally well, you don't really have to do anything. Just general routine care. I think the times to take your child to a doctor are generally uniformly the same. If they are not eating well and really stop eating or stop feeding well and you're worried about them getting dehydrated or they're having difficulty breathing, like you just notice their chest moving up and down, they're hard to catch their breath, they're not feeding well, then you want to see your doctor sooner rather than later.
Okay, and at what point, all right, so that do we need to take them to the emergency room? Because you kind of explained like, hey, you need to go to the doctor if this, and this is happening, but is there a point where maybe it escalates really fast and they need to get to an emergency room?
Yeah, that's very subjective, but I think, and most parents' instincts about this are good. If your child is, again, generally just kind of doing okay, still eating, but just not feeling very good, and you have worries, I think seeing your pediatrician or your family doctor is a good idea. If you feel like it's more severe, like your child will not eat or is really having difficulty breathing, then there's no time to waste. These things can get bad very quickly, and you should probably go to the emergency department or urgent care sooner rather than later.
Okay, and really quickly, let's go over who gets what when you're a pregnant woman, who gets what when you're an infant child, who gets what when you're over 60.
In summary, we didn't talk about the RSV immune globulin. That is actually recommended to be given to every single child born if they're 8 months old or younger in RSV season. That means if you're born during RSV season, the recommendation is that they receive that medication in the first week of life, if possible. We can even give it in the newborn nursery before they even go home. So that's a universal recommendation to everybody. Same thing for the flu. Anybody recommended 6 months or older, we recommend that everybody receive a flu shot annually. For COVID, if you're 5 years or older is the recommendation, but there is a new seasonal vaccine with the latest variants in them. It's bivalent. It has 2 different things in it, that everybody receive that as well.
Okay, gotcha. Well, thank you for your time, your expertise. And so we answered lots of questions, and we want to make sure that everyone at home is able to go back and listen to this again, get the information that they need. So that's going to be in the To Your Well-Being section of WFMYnews2.com.